Because how many of you have heard that part of the problem with this is that nobody's income is getting verified? It's just horrible. People are just going to be scamming all over. I got an email from Diane Black. This is how I know. People are going to be scamming it all over the place, and there's no verification. They just put anything they want to into the computer. It's terrible. Have you heard that? Oh, it's just awful. Isn't it awful? Wait a minute. We have the best verification that's going to happen, and it's when you file your 2014 tax return. Okay? And it's actually a very good system, because instead of coming up with a brand new government bureaucracy with a brand new bunch of red tape to go through, we already have enough government bureaucracy and enough verifications, checks, and balances right there at the good old IRS. If you file your taxes in 2014, your 2014 taxes in January 2015, if you got on this marketplace and said that you only make $21,000 a year, then when you file your taxes, you made $52,000, you're going to be paying back some subsidies, right? They're going to catch you. Simple. Okay, so let people know, nope, healthcare is a life and death issue, and we've got this handled. So here's how this is going to work. It's all about what you actually make, and that's verified by the IRS. So folks between 100% and 400% of the federal poverty level, that's a little $23,500, a little over $94,000 for a family of 4. So that's a big range, 100% to 400%. Those folks go on the healthcare marketplace, find out how much their insurance is going to be, look at their plan that they want to have, and those folks would get a premium tax credit. That premium tax credit doesn't have to be upfront paid by them and then paid back at tax time. It goes straight to the insurance plan that they pick. Okay? Now again, when it's time to file the taxes, if they had a loss of income, if they made less money than they had estimated, and if something significant happens during the year, they can adjust it during the year as well. But let's say you just let it roll out to 2014 and you made less money than you had expected to. There's going to be more subsidy coming back to you in form of a tax credit. If you made more, if you got a big bonus at the end of the year all of a sudden or something, then you're going to have an adjustment for that as well. But that's how that works. So it's a good plan. And again, like we said, help starts as soon as you begin paying premiums. You don't have to wait till you file your tax returns in 2015 and get it all paid back to you. Okay, some of this information, I'm so excited that the real numbers are coming out on October 1st. And we don't have to use the Kaiser Family Fund calculator and estimates and all that stuff anymore. I almost took these out. But I think they're kind of neat. They're in your slide thing. They're estimated amounts. They're not based on actual plans. But it sort of helps you see, for a single person making $17,810 a year, they're going to pay a maximum 4.23% of their premium. Wow. Because the way that this works is the insurance companies still have to be paid. They still have to get their money to insure you. But what makes it affordable is the subsidy. So the insurance companies are asking for less for their premiums because of competition, which everybody in America loves, right? Competition, free market, we all just love it. So why are they complaining so much? But the competition drives things down. Premiums are going to lower for healthcare plans, for employer plans, for all kinds of things. Delivery of medicine is all costs are going to go down, but because more people are going to be getting it. And the only way we can get them to get it is the subsidies. How many of you have heard the big complaint, if you start paying for them, they'll never take care of themselves. If you start giving people something, they'll never be able to take care of themselves. You're actually hurting them.
Making them dependent.
You're hurting them by helping them. They should have to do it themselves. They should have to pay this themselves. Well, what we need to do is say to them, this is a life and death situation. Yes, we don't want to feed everybody. We want to teach them how to fish. Okay? But this is a life and death situation. And if your neighbor, if your mother, if your child were in this situation, don't you think it makes this country stronger for everyone to have health care? Just bring it back to it's a life and death situation. And so the premiums are really important. If we had wanted to eliminate all health insurance and not have any money and any profit for health insurance companies, this country could have decided to do that, right? Right? Yeah, some people thought that might have been a better idea, but we didn't do that. What we did was say, health insurance is how we're going to deliver health care in this country, and the only way we're going to get health care for people making $17,000 a year is by helping them. So a family, I'm sorry?
I'm trying to understand your numbers.
Yeah.
If we go back to that other one, where does that percentage come, the 4 point?
Well, all of these slides are the same formula. So let's go ahead and stay on this slide. And it's in the law what's determined where that percentage comes from. And right back here?
Well, one thing I noticed moving here from California, a very expensive insurance market, is just how heavily this state is involved with keeping premiums down. Mine were cut by almost 2/3
Wow.
when I moved here. So this socialism argument is so false because, again, at the state level, Tennessee works. They've got very strict rules
Right.
for insurance companies to operate
Right.
in municipalities.
And that headline that we had recently, I don't know how many of you saw it. We were all sending it around on email. It was in the Tennessean. Tennessee among the lowest 2 to 3 with insurance premiums. Of course, we're also among the lowest housing costs. We're among the lowest
And worst health.
and worst health and other costs. So, but it came a nice headline. It came a lovely headline. It doesn't mean that our folks who are making under 400, under 200% of poverty level can afford that low insurance premium any better. We still need to be helping them and telling them about it. So here's an example that's a family of 2. Down here there's a little star. These are 60-year-old non-smokers. That's how this was figured out. So making a little bit under $40,000 a year. Their maximum is 8.2% of the premium, and the calculations are that their yearly premium, their total premium is $16,382. Times 8.2%. Their portion of it is $3,243 a year, and it comes out to $270 per month. And if you talk to 2 60-year-old non-smokers who've been trying to get their own insurance policy somewhere, it's a lot less. Family of 3, $30,000 a year. This might be a family with a stay-at-home mom and a new baby. It might be 2 folks who are both going to school and getting part-time incomes. You got a lot of folks in this situation. Maximum of 4.13% of their premium. And they also are going to receive help on their copays and deductibles. And that's another little wrinkle that we'll talk about kind of briefly. Jim?
Where is that formula found as to whether it's 4.3,
Oh,
8.2?
Mary, what page of the law is that on? Do you... Right. You see, you even stumped Mary. Jim, why do you want to know that?
It's a progressive formula, and it's in healthcare.gov in the training materials. It starts at 2% at the poverty line, and it goes up to 9.5% for 4 times the poverty line, and it is a graduated progressive percent, kind of like your tax code is progressive for paying 38.5 at the high level. And so it's a progressive table.
If you go into help at the kff.org site and do the subsidy calculator there, it will, and you put in different ones, a family of 4 with, at $30,000, it'll tell you exactly what the percentage is that they're at. And it's a fun thing to play with, and you can think of people that you know, and their 27-year-old son probably makes about $15,000 a year. He smokes. This is what he's probably going to be paying, and that way you have an idea of what kind of, when you're out talking to people.
What? That previous slide. That previous slide, there was a problem with that for Tennessee. We provide TennCare for families up to 126% of the poverty line for folks with dependent children. So probably that family would qualify for traditional TennCare.
Yeah, if it was a family through a
So you
dependent
could
child.
make that a Tennessee
Yeah.
specific and make sure they're
Right.
just over that.
Right. Linda?
A question about the poverty line.
Okay.
For those folks who, because we didn't expand TennCare, say they're even below the 100%, assuming they have a relative or somebody who could afford to pay their premium, can they enroll in this at all? If they could find a way to pay a premium?
Yeah, they can enroll, they just can't get a subsidy.
No subsidy at
No
all?
subsidy.
If
They don't pay taxes. What are you gonna take the tax credit out of?
Yeah. There are a lot of things that happen around the 100% level, below and above. There's, well, this is sort of an aside, but one of the things that I learned from Brian Hale at the THCC conference, because I hadn't really paid too much attention when Governor Haslam made the choice to not do our own state plan. And you know how it was set up was that each state had the choice to create their own healthcare marketplace. And one of the good things about that is you can do things that are good for your specific state. How many people do you have in poverty? How many people do you have working for themselves? Things like that. And also it made it kind of a laboratory. Each state would get to look at the law and use their big brains and all their smarts to figure out what are the weaknesses here and what can we do to make it better. Test those things out at the state marketplace level and then find the best methods and the best things to fix it for everybody. So at the state level, Governor Bredesen had our department in there working, seeing what could happen. And a program was devised called Bridge that was going to help bridge a bunch of the different things that happen to you at that 100% poverty line level, a little below, a little above. Are you going to be on Medicaid? Do you have dependent children? Do you qualify for CHIP? Do you qualify for this, that? And help families that have a plethora of confusing situations to get through that. Now, I am not suggesting whatsoever that we try to figure all that out. We need to know the right resources in our local places that can help people figure that out. But if all of us try to do it, we're going to miss out on all the time that we need to be spending doing outreach, which is really important. So, but I wanted to mention that because a few months after Governor Haslam was elected as a moderate, you know, his moderate self got elected. Well, it's time for a Republican governor in Tennessee. So a few months after that, he pulled the plug on our state-run exchange. He said, we'll just do a federal exchange. And a bunch of states did that. And we missed out on the opportunity to solve the problems for some Tennesseans, to be innovative, to show that Tennessee isn't what we get made out to be on The Daily Show and on The Colbert Show. Okay, we've got tremendously smart, tremendously dedicated people here all over the political spectrum. It's not about ideology, it's about dedication to Tennessee. And what we miss out when our leaders that we've elected don't show their loyalty to Tennessee is an opportunity to do that. So Governor Haslam pulled the plug on that, and I found that to be one of the most disturbing things. And we're going to talk later on about Medicaid and what's going on with the Tennessee plan expansion. We'll probably get disturbed again, I think. But let's push forward with this. And here we had that family of three. Mary made a good point that brought all that up. And then our four-leaf clover family, maximum of 4.13, they're making $36,000 a year. They're also going to receive help on their copays and deductibles. So how does that work? Just a little bit about how that works. When someone is picking their plan, bronze, silver, gold, platinum plan, they're deciding how much their monthly premium is going to be and how much their copays and their deductible is going to be. So let's say their premium is going to be $100 a month. They're going to pay a $500 deductible. So the first $500 that gets spent on different health care needs, not including preventative services, but it's going to come out of their pocket. Once that $500 is paid, then another level of care is going to kick in. And their copays and deductibles are set. But at a certain level of where they're at with the federal poverty level, they're also going to get help in that plan with the copays and deductibles. So instead of maybe, again, this is all, you know, pulling numbers that are easy to talk about. Instead of a $25 copay for an office visit or a $75 copay for a emergency room visit, they're going to get assistance with that to bring it down. So it might come down to maybe a $10 copay for that office visit, maybe a $25 copay for the hospital visit. So those are things that are going to help in those plans. And also they can give assistance with the deductibles. So again, we're not going to be enrolling people. We're not going to be sitting there with them while they're online picking out the different plans. But if they get concerned or they've heard a rumor or they've heard, well, even if I have insurance, I'll never be able to spend $150 a day to be in the hospital. That's way too much, you know? Or whatever, because I keep hearing crazier and crazier stuff every day. You know, let them know that there is assistance, that it's based on your income to make it affordable. Sit down with a navigator to help you go through this. Sit down with an in-person assister and go to your local library or here's your local health clinic and here's here's where you can get that help. But try not to get bogged down into all that.